So PCOS per se, it is very common these days. Like in an OPD of around 100 patients, you get at least 20 to 30 patients who come with ultrasonography features which are suggestive of polycystic ovaries. So first of all, only polycystic ovaries, you should not jump to the diagnosis of PCOD. So only polycystic ovaries are not enough for a patient to be diagnosed as a PCOD case. Otherwise, yes, this is one of the features of polycystic ovarian disease, and its actual incidence is around 3 to 20%. So this wide range of incidence it depends upon the place where the woman is residing, the type of lifestyle she's having, the type of diet she's having, and the number of stressors in her life. So, and the reason why it is being exhibited these days more is because of the change in lifestyle of the patients. They are being in a competitive race every day. So that adds to the stress in a woman's life. Plus, the dietary habits are changing. So people are shifting more towards the westernized diet, not westernized, but the complex diet, that is complex carbohydrates they're having, more of pastas and cheese and that stuff. So all these things, they are a trigger to add on to the other things, other risk factors which are already present. PCOS is a diagnosis of exclusion first. So once we have excluded all the other causes for whichever the patient has reported to us, only then we label the patient as PCOS. Plus, it has multiple factors. One is the hereditary factor, which we cannot correct. So if a patient's mother or her elder sister is exhibiting signs of PCOS, she is automatically at a higher risk. So the things that a woman can change in her to bring about, to prevent her from landing up into PCOD, so those can be that she can work out daily, she can exercise daily, she can change her eating habits, she can cut down on her calories, she can change to less complex diet. All these things, these all would contribute to reducing the risk. So we cannot just point out one feature or one risk factor. Yeah, a holistic approach would be a better one because it is a lifestyle disease, if we could say it. Because of the changes in the lifestyle and the eating habits, this disease is coming up as an epidemic. So the first and foremost treatment for anyone would be weight reduction and shifting to a more healthy diet. So this one treatment is which works on every female, be it an unmarried woman, be it a married woman wanting conception, and be it a woman who has completed her family. So weight reduction and cutting down calories, eating a healthy diet helps everyone. Then other treatments, we shift to them only after we get to know the requirements of the patient about the conception, about the cycle regularization. That depends upon it. See, PCOS management should be a priority even if you don't want conception at the moment, because once the ovaries, they become polycystic because of all the risk factors which I have discussed, then it is very difficult to resume the functions of the ovaries. So, and if the ovaries of a female, they are not functioning properly, there will be hormonal imbalances, which will lead to poor egg quality and ovulation. That is, the ovary releases egg every month, then ovary won't release the egg every month, or the release of egg would be delayed. Some months the ovary would release the egg, some months it won't. So that would decrease the chances of conception for them. So it is very important that as soon as you find changes happening with your body, like increased hair growth, cycles getting irregular, or gaining weight, or having hirsutism, that is excessive hair growth, or having acne which are developing every month, so you should be a bit aware of these signs and symptoms and you should report to the doctor. Yes, I think this issue and this topic should be like the younger girls should be aware of it to an extent so that they can pick the symptoms as soon as they develop. Like if the patient is otherwise getting regular cycles and suddenly she starts getting delayed cycles or is missing her cycles, she's putting on weight, she's developing acne, I think she should report to the doctor and get herself checked up hormonally so that the hormonal profile can be done for her. And one thing to remember is that as if this disease or if these changes they are detected at an early stage, just lifestyle modifications they help to bring back the ovaries to their normal functioning. So it is good if you detect them at an early stage. So it is always better that the patient reports as soon as she sees such symptoms in her. See, one is that women should exercise. They should go for a walk 30 minutes daily minimum who have PCOS, because reduction in weight, it is going to help. It is not that you think of losing 10 kgs or 20 kgs and it is going to help then only. No, losing 1 or 2 kgs is also going to benefit you. And secondly, you should try to shift to a more healthy diet, which is fat free, oil free, should avoid junk food as much as possible. One thing is that reducing 500 calories from your diet every day from what you are having at present will help you reducing weight half kgs in a week. So by just reduction of 500 calories, which might be just one serving of a junk food, it is going to help you reduce weight. So I think these are very simple things that can be done, and not hormonal and not medications. They are just lifestyle changes. These could help you a lot. Yeah, see, you should set achievable goals for yourself. Do not set goals of losing 10 kgs or 20 kgs. See, abruptly, if you cut down calories, even that is going to weaken your immune system. And that is also not good for your body, not good for the health of your uterus as well. Because there is a minimum amount of calories, minimum amount of fat that your body needs to function. So, irrelevantly, cutting down the calories is also of no use. You should always be focused on what you want to achieve, and the goals should be achievable.